Right, welcome back and thank you so much for staying with us here on Morning Live. Now, today communities across the world will host a candlelight memorials to raise social consciousness around HIV and AIDS. 36 million people currently live with the illness globally, with 7.1 million of them residing here at home in South Africa. Experts say although the country has one of the largest domestically funded programs to stop this epidemic, stigma and discrimination still remains one of the biggest challenges. To discuss this further, we joined now in the studios in Johannesburg by the CEO of the South African National AIDS Council, Dr. Sandile Buthelezi. Dr. Buthelezi, good morning to you. Thank you so much for coming through.
Good morning, Palesa, and good morning to the viewers.
Thank you so much indeed. We do know that, of course, the big day is this coming Sunday, but there are activities, of course, in the build-up to that big day on Sunday.
Yes, no, that's true. I mean, this is actually a movement that was started about 35 years ago. And of course, the context at that time has totally changed up to now, but we think we still have a long way to go. But more so as a country, you've mentioned something, but I also want to put it to the context when you say 7.1 million of people who are living with HIV in South Africa.
In South Africa.
That means it's about 19.4%, between 19 and 20% in terms of the global burden. And this is a country that is only less than 1% of the global population. That's very important to put it in that context.
So is it a worrying number?
It's a seriously worrying number. It's a seriously worrying number, especially if you look at the proportion of the population that we have in South Africa vis-a-vis the global population.
But how far have we come in terms of our efforts in South Africa to sort of stop this disease and fight it?
Yeah, I think there's quite a lot of successes that inspire our response as a country. I mean, where we're sitting here today, of course, we still have quite a lot of new infections, as we're sitting at around 170,000 new infections. But if you look at 10 years ago, around 2006, we're actually sitting at about 680,000. So there's 500 infections. Yes. Yeah. So and that's quite a huge number. But also, if you look at the number of people that are dying, we've actually decreased that. A lot of lives have been saved, and we've actually improved the life expectancy of the people. But I think one of our serious success stories is our vertical transmission. That is your transmission of HIV from pregnant parent to the child. I mean, when we were sitting at about 19% intrapartum transmission, meaning that in numbers, if you look at around between 2003 to 2005, we're sitting at 19%, and in numbers that means more than 70,000 babies were born HIV positive. Fast forward, we're sitting now at less than 1.5%, meaning less than 5,000 of the babies are being born HIV positive. That's still a huge number.
That's a significant drop.
It's a significant drop.
What are we attributing it to?
No, we're attributing it to a very good response, but more importantly, it's visible leadership, which is why now we're actually grounding our response on visible leadership at all levels. That's why we're trying to focus on, but also having very focused attentions to programs that work, where we can see results, but taking a project management approach so that we can see the results.
As much as the numbers are dropping, as you say, Dr. Buthelezi, but the issue of stigma around HIV and AIDS is still a huge problem, more so here at home. There's a Lancet medical journal that was published last year that actually revealed how facilities are brought to communities, but people are opting not to use them purely because of, the stigma around HIV and AIDS. How do we deal with that? Because that, of course, remains a huge challenge.
Yes, it remains a huge challenge. I think there's a number of issues. I think the first thing that we must understand is that the HIV response is a community responsibility. So we need to ensure that communities lead the response, communities own the facilities. So that's the first thing we need to talk about. The second thing is that we need to invest, specifically government need to invest in ensuring that our frontline workers are actually the change agents in terms of addressing the stigma. True. Because one of the big drivers of HIV infections is people who are afraid to come out, people who are afraid to test, but people who are afraid to, because if you have not tested, you don't know your status, then you can't get treatment. Now, meaning that we have a number of people in the community who are HIV positive, have got high viral loads, and are highly infectious. which is why then when we talk about HIV as prevention, is that the more we get people to know their status and put them on treatment with universal test and treat that we have implemented as a country, we can have a lot of people being virally suppressed and hence less infectious. So it's very critical for us.
It is.
So hence the stigma of getting people to come up, go to facilities. Hence, if our facilities are not friendly to the users, they are actually part of the problem.
I wanted to say so that
the infection.
In the contrary, you get people who know their status, who are aware that they are HIV positive, but they fear to go to these health institutions because of discrimination.
Yes, yeah. So basically what we want to try and do is to actually get these people, they must actually come up and report these issues, because that's not a policy of the department. I mean, our National Minister of Health is very clear in terms of what needs to be done, that our people that are actually working at the front line must actually ensure that they don't create the barrier to health services, because they are then inadvertently fueling the infections in the communities.
Yeah.
But leadership in those levels, which is why we're actually now moving our response to the lowest levels in terms of the wards, to ensure that the ward councillor, they know how many facilities are there, how many people go there, they go through the war rooms, and people are able to report these issues to the ward councillor so that they are taken up and then proper remedial action is taken to actually address those issues.
And surely there should also be some common conversations within the communities themselves. Let's just talk about the UN AIDS strategy. How far are we from that particular strategy of zero AIDS-related deaths, zero new HIV infections, and zero stigma and discrimination? Are we closer to that strategy?
I'll say yes, I'll say no. Okay. But if we're looking at 2030 and what in terms of achieving that kind, those kinds of targets, we need to change the way we do things. If it's business as usual, we'll never get there. So we need to rethink. Let's see what we've done before. I mean, if we should be brave and say, if something doesn't work, let's drop it, let's take something that works. But critically for us is focused approach. For example, let me talk about Gauteng as a province. Yeah. We know that 75% of infections in Gauteng are in 3 metros. Therefore, you cannot have a homogeneous response. If you go to Western Cape, 71% of infections are in the city of Cape Town. So we need to have a focused approach to those areas that are problematic and the micro-epidemics in that area. And we have focused interventions that are context-specific.
Yeah, designed specifically for those areas.
Because, of course, the design of an intervention in Sandile cannot be the same as the design of an intervention in Dipum Kanyagute in Mhlabialinga, because the contexts are totally different.
True. All right. Yes. Dr. Buthelezi, there's so much to talk about. We have to leave it at that. Thank you so much for coming through.
Thank you. Thank
you so much to South African National AIDS Council CEO, Dr. Sandile Buthelezi. Today, as we said, communities across the globe will host candlelight memorials to raise social consciousness around HIV and AIDS. The big day, of course, this coming Sunday. All right, we're taking a quick